And looking ahead, what changes in awareness, diagnosis, or monitoring would are you looking forward to? What would most improve outcomes for patients with systemic mastocytosis? And that goes for the both of you. I would love to hear what you think.
I'm so glad you brought up your website because it's a plethora, a wealth of information. Thank you so much. I mean, I think that patients really lean into all the things that Jessica and her team and TMS for Cure has built. So great. As far as that's a hard question because it's individual to the patient. You know, we've seen patients where they come in and they have like the worst mastocytosis rash, and again they are like, yeah, nothing else bothers me, and all they wanted was the rash to go away. And so I think that's a hard one because every patient is unique and different, and even when all the other things look great, they can still feel profound fatigue. And even when all those other things look great, we still worry about, for example, their potential for a fracture, an unexplained fracture, because maybe they have really bad osteoporosis. So I think with each of those, we have to kind of assess what's the most burdensome to them medically and what's the most burdensome to them kind of psychologically, cognitively, or functionally. And then what is it that's alarming to us as physicians in terms of what they look like and kind of mesh those things together.
On like I totally agree with everything that Dr. Siri just said. But thinking like on a more like global level for like the whole community of mastocytosis, researchers and patients alike. The things that come to mind for me is I would love for there to be a more clear screening and testing protocol, and then awareness to community physicians on that, so that they would have less of those questions around like when should I refer, what tryptase level. There's just so much confusion around that. And then on the research side, I always remind patients when they're kind of frustrated, like, why don't we know more? What's happening? You have to remember that the first time systemic mastocytosis was mentioned in a medical journal was in 1949. We're not even 100 years out from that. We're still learning so much about the mast cell. And so I'm always going to advocate for more clinical research around basic mast cell biology, especially mediators and receptors, and really any part of the mast cell that could lead us to more additional biomarkers that can help with that then testing and screening process. And that just gets us closer to faster diagnoses and better treatment.
Wonderful. What's one thing you wish every clinician understood about living with systemic mastocytosis?
Is this for me or for Dr. Siri?
Both of you.
No.
I think you both see it from different angles. So I'd love to hear from both of you.
I mean, I guess I would say that just to remember that patients with systemic mastocytosis, they know their bodies and they know their triggers extremely well because their safety literally depends on it. That at least that's the way they feel. And so incorporating their lived experience into the clinical decision making is really important for both the safety and outcome of the patients, but also like the trust and relationship that the clinician and the patient are building together. Sometimes I think it can be so frustrating because it's like, well, I gave you all these medications, it should be working. But if a patient's coming to you and telling you, no, I'm still having flushing, I'm still having this, you just got to keep working together to try to get to the bottom of it. And that's really the best thing you can do for the patients. That's what I hear the most.
How about you, Dr. Siri, from your perspective? What do you wish that your colleagues knew more about systemic mastocytosis?
So for colleagues and for patients, kind of two different kind of asks or my hopes in any case. So for colleagues, I know we have a lot of patients who are now being coming to the doors asking us to work them up for mast cell activation because I think that there's a lot of more knowledge about it. And so I think that sometimes patients are complicated. There's a lot of stuff that they need to talk about. And there are a lot of symptoms, and it can be frustrating because there's so many facets of the disease. And so I think that sometimes doctors who already are short on time, underpaid, overwhelmed, you name it, that if if we can all work together to kind of think about some clear guidelines that say, hey, can we find out who has systemic mastocytosis? So simply, invite them in, do some simple screening tests, and then see if this patient has SM or not. I think that I want to continue to encourage my colleagues to basically look, again, simple blood tests, even if they did 2 tests, which is tryptase and a KIT mutation, that would be enough. And I think that at least a lot of patients would be picked up that already are diagnosed, and they would be eligible candidates for additional treatment. So that would be the simple ask for many colleagues. And I'm talking about not necessarily allergist immunologists. I mean, other people, GI doctors, primary care doctors, family practice who've been managing these patients for a long time. It's simply those two. It's not any more complicated than ordering a complete blood count, a CBC, for example. So that would be a really great ask. And if the patient then is identified, then they'll be able to funnel them more appropriately to the specialist, who usually has a lot less availability. So they're like, yes, patient has an elevated tryptase, or patient has a positive KIT mutation. Fantastic. That makes it really, really easy in terms of those guidelines. As far as for the patients, I know you've been struggling for so long, and it really does help if you are a little bit organized in terms of your presentation to your doctor, which means, these resources that Jessica is talking about, symptom trackers, having copies of your labs, and having this picture of who treats you, what have you tried, what medications have you tried? How much medication are you taking over the counter? Is it fexofenadine 8 times a day? All those written down. I love binders. Not everybody loves binders. Not everybody likes journaling. I get it. But, when you go to the doctor, to have that information all linear really helps, because when we spend 15, 30 minutes, an hour, 2 hours with the patient, we can't encapsulate your entire life into that visit. And so it really helps if you're prepared when you come in, because then it'll help us diagnose you better.
Wonderful. Well, this has been a fascinating conversation, and I know a lot of people gain a lot of value from this. Thank you so much for joining us on this installment of MD Newsline podcast. And I look forward to hearing from you ladies in the future. Thank you.
Thank you for having me.
Thank you.